It's a pleasure to join everyone and to meet everybody who's joining virtually. So we focus very much on the intervention of building out the workforce, from connecting the community health worker into the facility, and specifically really where that connection, what that connection can look like, because while community health workers are deeply needed for outreach and they're extraordinary advocates for their patients, if you have a woman who's hemorrhaging, she needs definitive care. And so where the opportunity for us in seeing especially women in the workforce and women's empowerment through health has been both for what we can do for the patient, as well as what we do for the provider and the role the provider can play. And so we've been working in partnership with 4 countries in sub-Saharan Africa to focus on building out the cadre of midwives. So if you look at the number of expected deaths in childbirth over the next, by 2030, almost half of those could be prevented just by the scale up of skilled birth attendants. And so we're talking about hundreds of millions, about 400 million preventative deaths that could be prevented if we scale up midwives. And so midwives are mostly women. So there's a big piece of job creation for women and formalization of their roles in the workforce. And to give an example, we worked in Uganda in partnership with Lyra University, where we helped them to open the doors of the school for midwifery in the north. And we started in partnership with the school at ground zero. So it took 4 years to graduate the first class. And in 2019, we looked at the outcomes of that class. All 100% are employed. All but one of them have actually remained in Uganda. 87% are actually working in the public sector still. And because when we help empower these women to know how to save lives, they want to stay in the system and keep fighting. We've seen this in Malawi, where we've opened the first ever model midwifery ward. So it's a midwifery-led ward in the country where all care is given by midwives. It's only second in the region. And we're starting to transform both how women receive that care. So women are now traveling hours to deliver in the facility. But we're also helping to create a pathway for showing dignified maternity care. Just to give a very precise story, just reading a story of one of our colleagues who was delivering, a woman had come in from the village. She'd been delivering for over 24 hours, and it was her 6th child. The baby was not passing. And so they moved her in, says she came into the facility and they realized what happened, the child was breech. So the original team came in and everyone was sort of really, there's a lot of chaos and people were really trying to, figure out what was going on. And in partnership with the faculty and the team we built, we changed what that birthing experience was. So it became quiet, it became calm, it became championing this woman through a very complicated delivery, and the child was delivered safely. And the rest of the team said they had never experienced actually being part of a delivery like that, but then they started to teach it to others, and we saw the cascade of what happened. And so as we're doing this work, 70% of healthcare is provided by women. So our job is to create a pathway to formalization and to build those jobs out, and then to tell those stories and to make sure it gets institutionalized at the level of governments. But we can't do this without private sector investment, and it has to be long-term. You have to be thinking about the fact it takes time to see this through, but it is transformative. And so SEED certainly is looking for support to scale our programs in Sierra Leone, where we're building a national midwifery program in partnership with the government there. We're only in 2 districts now out of 16. We need to be at all 16 for a country that has the highest maternal mortality rate in the world, where 80% of women are delivering in institutions, but they're still dying. That's the lack of the skilled birth attendant or that quality of care. And that's the piece that we can intervene. And I'm incredibly privileged actually to be here with my colleague from the AfriCCC and African Union, where we're thinking about how do we systemically create this and create these opportunities and really build out that narrative. And that is 100% going to rely on large scale private sector and audacious investment to think about how we transform that moment, build those models, study them, learn from them, and create those cases for investment that we can then really galvanize around and show the importance of this for social stability, global health security, economic recovery, job creation. Obviously, I could continue, but I will stop. So thank you for the opportunity to join you on this really important discussion.
Thanks so much, Vanessa. And as some of you know me, I'm going to drill down a little bit on that. And I think a little bit is that by way of background, a little bit of what we do is broker some of these partnerships between the private and public sector.